what's going to bring you closer to that value? Is it being outside and going on the walk, or is it staying in bed, not doing anything? So I always think to people that, when the going gets tough, look within to see what it is that is important to you and what matters and what can carry you through the toughest.
Oh, I gotta go. I've been working, told them please don't hit my phone. I'm in my zone, bruh, just leave me alone. Was on the road, but I swear I'm coming home. Now the drinks on me, I think we need a toast. See, I did it for me. Now my old friends calling, told them nothing's for free. Told me time is money, dog, swear I paid all my fees. I was starving for this game, now my family can eat.
Hey everyone, welcome to another Cup of News episode with your hosts Peter, Matt, episode 71 here, almost on the road to 100. It's always a pleasure speaking and educating you guys, and thank you everyone for tuning in and listening to us. If you find any value in this podcast, please give us the 5 stars, share this with your loved ones. This is how we grow the podcast, and this is how we keep on continuing to get motivated to producing this high quality content. Some announcements: cupofnurses.com and cupofnurses.shop. Check that out. Some hot merch there. We have all of our show notes. Anything about us will be there. And also frontlinewarriors.com and frontlinewarriors.shop for anything related to our conscious movement that we're starting. Tune in for that. Our vlogs, we're continuously growing on YouTube. So thank you all the subs there. We appreciate you guys. Check it out if you want to see our beautiful faces. And also the Cup of Nurses group, where we engage with our community, everyone that listens to on the podcast. They're there, where we're sharing feedback and some fun stuff there. Tune in. How you doing, Pete?
I'm doing great. We have another amazing guest for you guys. It's our friend Aleks Zubek. She has a master's in counseling psychology and is a licensed professional counselor. We dive into some interesting topics such as depression, health anxiety, and just finding your inner self. So make sure you guys tune in and check it out. Hey, Aleks, thank you for being here for the third time. And you've had some cool experience and cool news that you recently went through. You got your master's in counseling and psychology, and you recently became an LPC. Can you walk us through that process and why you went into that?
Sure. So in the current state that I am practicing in, which is the state of Illinois, in order to be a therapist, you can take multiple approaches. And it varies state by state. So like California, Texas, Arizona, all these states have different letters, different forms of licensure that you can get in the state in order to practice. In the state of Illinois, with my degree in psychology, I have the ability to become a licensed professional counselor. And then after 2 years of experience, I can take another test and get a higher license. So currently in my role, I do have to practice under the supervision of somebody because I'm a 3-letter therapist versus a 4-letter therapist, which would be an LCPC versus an LPC. And same thing with social workers. For example, social workers in the state of Illinois can also be therapists. So like the traditional, you sit on a couch and talk to them. You can also have somebody who is a licensed marriage and family therapist. You can have somebody who studied school counseling also take on the role of like a therapist, depending on, level of licensure and things like that. The state of Illinois does give you several options. And like I said, that varies state by state. So because I had an interest in a lot of like mental functioning, neuro stuff, the psych degree kind of took me in that direction versus, for example, social workers, they take a look at things that happen within society that, cause certain issues. And I'm not saying that one or the other is better because my undergrad degree, I have 2. One is in sociology, one's in psych, so I have that background from both. But it's just like each each way that you approach this path, you kind of get a little bit more information and something more specific. So I could see why somebody would want a social work degree over a psych degree or vice versa. But my interest took me the psych route. And, the natural way that then I would become a therapist was getting that master's degree, getting that internship, and then getting that specific license. And that, I didn't necessarily have a say in the license. It's just that's, the natural way that you would do it in Illinois versus another state.
Okay. What is your day to day as an LPC? So when I'm envisioning the process, I feel like it's less of a collaboration like in a hospital setting, and it's more of like a coaching sense where you're one-on-one with this client. You see him once or twice a week, whatever the case might be, and you're helping him, coach him, or counsel him through the process that is that the issue that he's having.
Okay, well, that's a really good question. And personally, for myself, it is, a lot of one-on-one, a lot of meeting with individuals, but that's not what I'm limited to. So, for example, because I am in private practice right now, the expectation is that I work, with individuals on a more private, like one-on-one basis. But with my degree, I can also work at a hospital. I can work in an inpatient setting. So like people who really need a high level of care that are in the hospital, or I can work on like a partial hospitalization level. So people who are okay enough to go home for the night, but then they have to come back and do like a full day of programming, I can do that. I can work as like a school therapist, or I can do lots of things, but it just depends on what it is that you prefer. There's obviously pros and cons to doing a lot of the things that you can do as a therapist. Some people thrive within that structure of being at a hospital. So in the hospital, it's not just the therapist by themselves. They're interacting with the people who fight for insurance benefits, which unfortunately is a thing. The doctors, the nurse practitioners, the behavioral therapists, the dietitians, whatever it is. So there's certain areas where you do work with a team, but in my private practice experience, yes, I have people that I reach out to. I have a supervisor. I have a group of colleagues that we meet with once a week, but it is more individualized. It is a lot more independent, and a lot of people do have that opinion that it's very lonely. In private practice, I personally don't have that experience because I have a lot of friends, a lot of my colleagues, we talk to each other on a daily basis, sometimes like hourly if we need the support, if we need to, get something out of our system. But a lot of people who have their own private practice, for example, and they just work by themselves doing everything, they don't have that like system or support group to reach out to.
And you said with being an LPC, you work under somebody with 4 letters instead of 3. So that person you go to kind of brainstorm ideas on how to help somebody, or how does that work? Like, do you need their like approval to take therapy in a certain direction?
So yes and no. A lot of the way that I work, my 4-letter trusts me enough to, go in whatever direction I go in, and they never question that. But it's just the fact that I have them in case I am stumped, or in the case that I come upon something in the therapy room that I've never had experience with. I can reach out to them. I can ask them for suggestions. I can ask them for like literature that I might need, because and I know there's a big misconception that when you're done with school, you stop reading, you stop learning. But, outside of the mandatory continuing education, therapists do a lot of research on a day-to-day basis. So I'm constantly reading books related to my patients, related to my cases. I strategically try to read at least 1 to 2 research studies a week on new findings in the mental health field, because I want to implement new and trusted practices in my work and not just keep doing the same old. Like if there's something that, people are finding is more helpful than the thing I've been doing, That's why I'm doing that research and that reading, because I want to help my patients in the best way possible and be up to date on, new cutting edge technology. And it's not just like we found one thing that works, so we're just going to stick to it. There's always room to improve our practices.
So since you're always at the forefront of technology and advances of research, what is like the state of the union when it comes to mental health? And I know the last time we spoke, you mentioned 9/11, how it brought people more together because there was this commonality, common goal to unite and fight off this terrorism that's happening. So you mentioned that COVID would actually bring people together because we have this one common enemy. Is that something you still stand by as a statement, or do you think that changed, especially with what we're seeing in polarity?
Well, I think that is a really good question. And I would say that in terms of what I'm seeing right now, I'm actually seeing that like we're coming together, we are working on ourselves, and we're working as a unit with our family, with our friends to take this thing on. I am seeing a lot more people reaching out for help, and instead of isolation, I'm seeing a lot more connectedness and seeing a lot more people reaching out. Now, yes, I understand that social media, the news, media in general is putting on this narrative that people are becoming very divided and people are becoming very polarized, and you're either on this crazy extreme or this other crazy extreme, but in terms of like the individual day-to-day things, I am not seeing that. I am seeing people recognizing that, life is short, like things are happening, disasters, whatnot, and it's better to do this with a team, like our family or friends, rather than challenging this on our own.
Okay. And what are some commonalities that you see when it comes to mental health and issues that your demographic of patients are experiencing?
I am seeing a lot of major depressive disorder and a lot of anxiety. So, because of the pandemic and just how the way it has rolled out, I'm seeing a lot of people with this need to have some sort of control in life when they have been experiencing the exact opposite, which is having no control at all. Just remember when we first started hearing about COVID and about these restrictions that we started getting put in place, it really shook people to the core who like to have things planned out. Like, I'm going to take a vacation in July, or I'm going to be able to do this, this, and this. With the pandemic restrictions, with, different mandates, different local, governances, not laws, I would say that a lot of people lost that ability to plan into the future, and this has kind of made those people who tend to run anxious in the first place even more anxious. And now, they're not able to sleep, they're constantly on the edge because they don't know what's coming next, and they're not okay with that.
So then with anxiety, are you seeing an increase in like health anxiety in people? And if you could explain a little bit about health anxiety.
Yeah, so health anxiety is an actual interesting topic that I'm sure you guys can resonate with, because the healthcare system, it is being kind of taxed right now. And with health anxiety, so let me start off with health anxiety is just being not okay with, small aches or pains, or constantly being worried that something's wrong, going to the doctor for all these issues that seem to not be connected or make sense. When somebody has this like alphabet soup-like presentation when they go to the ER, or they're constantly going to their GP and like saying, hey, I need this CAT scan, I need this MRI, I need this x-ray because I think something's wrong. There's actually nothing wrong. It's people like that that are overwhelming the healthcare system. And unfortunately, what happens, because there's not a lot of communication, like interdisciplinary communication, you'll have somebody who's being treated by like 6 or 7 doctors because they're not getting this information that they want to receive, and they're just looking from every other doctor they could find. So not only is health anxiety thinking that like there's something wrong and being worried that, you might have some horrible disease that just hasn't been discovered, but it's also kind of the way that you structure your life so that you're avoiding a possible disease as well. So certain people will not go to crowded public places, not because of just like COVID anxiety, but in general, they're worried about, catching like strep throat or pink eye or whatever. Even though the likelihood of that is so slim, they're changing their whole life around because they're so worried about this idea that they might get a disease or something like that. So health anxiety comes in many different forms and fashions, but it does become clinical when you're not able to do the things that make you happy or the things that you need to do because you're so worried about your health.
Where is it? Is there like an explanation for this? Like where it stems from? Is there people that are more kind of predisposed to this? Like you mentioned control. Are people that seek control or have a lack of control due to like COVID or whatever's going on in their life, are they more prone to this because in like a way it's them kind of controlling their symptoms, right? So is there an explanation for why this happens?
So, it could be multiple reasons. What I have found is that there's not one singular way that you develop health anxiety. And, there's just more people who are sensitive, people who tend to become overthinkers, or people who are just highly in tune with their bodies. Every single little ache or pain could become, a tumor, or, maybe they have MS or whatever. Like it just spirals into this big thing, but it doesn't necessarily have to be that. Health anxiety can, come from anything, and not having a clear-cut answer as to where it comes from is okay because the way that we treat it tends to be the same no matter what. So going off of that question, like where does it come from? A lot of the times when we see people, we don't know. We can't specifically say, hey, this one time that this happened is why you developed this disease, disorder, this, condition. We can't just pinpoint it, but that's okay because we don't need to, because we know that there's a certain way that you would treat this. So as long as we know how we're going to approach it in terms of treatment, the why is not necessarily as important. Like, sure, it helps, but imagine you found out why something happened in your life. Does it really change everything else moving forward? Like if you overcame this big issue in your life, you overcame it. Who cares why it happened, right?
That's a very good point. So with somebody having this health anxiety, and anxiety is a huge pandemic in our country, how do you troubleshoot somebody, or how do you help them manage this anxiety that they're experiencing? What assessment tools are you using or criteria to help the person figure out the how?
Okay, so just like a nurse would kind of determine how somebody's doing their activities of daily life, right? Like I start off with asking the questions of how is this impacting you on a daily basis? How often are you worried about this versus the average Joe? I like that question a lot because it kind of puts things into perspective, and not a lot of people are asked this question. Like, you could be a worrier, but you could just be an average person who worries. Like you worry as much as your mom worries or as much as your sister worries. So it's about average. But if you ask somebody, are you worrying more often than the average person? And, sometimes they say yes, that just opens up another box of questions that I ask. Like, how often would you say you're worrying? How many hours of the day would you say you spend worrying about this? How does this worry impact those activities that you're expected to perform? Do you find that you can't pay attention in school, attend to like your chores if you're talking to someone younger, or can you not hang out with friends? Can you not do some of the things that you like to do because you find yourself worrying? So those are the kind of feeler questions that I start off by asking, and then I go on to more as soon as we start developing a little bit of an understanding, a little bit of a relationship. I kind of start to ask like, what would happen if you weren't worrying? Like how different would your life look like if you had this time back, or if you had this under control? So that helps us create like a treatment plan and what we're striving for. So it's important to know like, yes, this is bad, but how do we know what good looks like as well?
So it seems like and I'm kind of trying to put a perspective of a nurse. It's you have this disease that's causing problems in the person's life, and then he tells you all these symptoms that this disease is causing. So, well, we don't want to put band-aids on these symptoms, and
Right.
we could start that way. You can start, taking away the symptoms so he feels better. But how do you get to the core of that individual's problem? How do you stop the disease from causing the symptoms that are affecting his daily life?
So a lot of the therapy that I do is based on ACT, which is acceptance and commitment therapy. And a lot of people come into therapy because they're kind of at their, end of the rope, and they seem to be able to like not come up with any more ideas. Like there's no other thing that they can do to help themselves to do the things that they want to do. So I begin by asking them, what is it that you want to do? What is it that, therapy will help you achieve? What's important for you to do that you want to do on a daily basis? What do you value? What kind of person do you want to be? And then those values and those things that are important to the person, we work on sitting with some of this pain, sitting with some of the anxiety, dealing with the uncomfortableness, because in order to do what it is that's important to them, they have to put up with a little bit of this discomfort, because, we like to think that if we push all the negativity and if we push all the discomfort out of our lives, life will be easy and great. But growth and a lot of, doing what's important to us, that uncomfortability comes in between where we are now and where we want to be, in the future, or it comes between what we're doing now and what it is that we value doing.
Yeah, I think pain is a very good indicator, because even if you have like a broken body feature, like in leg,
Yeah.
you can keep taking these narcotics that are going to take the pain away. And we have such a negative stigma with pain. It's like that false positivity that we kind of say, well, life
Yeah.
always has to be positive. Well, this pain is giving you an indicator of how much you can push your body. So this week, you could push yourself, let's just say 25% non-weight bearing. And next week, if you still keep taking Narcos, you don't know that now your body's ready to take on 50%,
Right.
75%. Now you could be 100% without non-weight bearing.
Yeah.
So how does depression play into this? Because I know anxiety and depression have like this bi-dimensional level. Is it depression that causes anxiety, you feel like, or is it the other way around, where this anxiety gets so bad where this person gets halted in his life, which causes the symptoms of depression?
I mean, of course, it could be either or, right? Like you could come in depressed and then develop anxiety, or vice versa. But just personally, and this is, has nothing to do with stats or data or whatever, but just what I've been seeing in my office is people who are anxious already, like super anxious, they can't do what it is that they want to do, and then develop depression because they're limiting the amount of pleasurable activities that they're doing in their day to day. And they're kind of stuck in their room. They're isolating because they're feeding into that anxiety, which is then causing them to, be a little bit sadder and sadder every single day. Or there's things that they're really passionate about that they're no longer able to do because the anxiety has such a hold on them. And then, this depression, this low-lying, constantly low, sad, depressed mood starts developing, and that kind of takes, a hold in that person's life, and it's really hard to break when you have anxiety telling you shouldn't do this thing, and then depression telling you, you don't have the energy to do this thing as well.
Because like an average person, they go through periods and cycles of anxiety and depression before like entering like you could say like the deep hole of it. What are some like tips or advice you give somebody that's just suffering through like the seasonal depression or just like anxiety in certain situations, so it doesn't turn into that ginormous hole?
Yeah. So I think that's a really good question. And I think that a lot of the times when you see somebody that was always active and outgoing and, pursuing things that they're passionate about, when they are no longer doing those things because they're letting the depression kind of creep in and cover more and more of their life, It's really important to keep doing those things, no matter how hard it is and no matter how painful, right? We just talked about that pain and that discomfort. So no matter how uncomfortable it is to do, your morning walk, because you'd rather stay in bed, and leaving bed would cause discomfort and, maybe some pain or whatever it is, some anguish, just go on that walk anyway, because the walk in the end will make you happy or happier than you were, in bed. And also you're going on that walk because it's bringing you closer to, whatever it is that you value. So maybe you value being outside, maybe you value Mother Nature, maybe, you value being athletic or whatever. So what's going to bring you closer to that value? Is it being outside and going on the walk, or is it staying in bed, not doing anything? So I always think to people that, when the going gets tough, look within to see what it is that is important to you and what matters and what can carry you through the toughness.
So like doing exercise and doing things you like, it releases endorphins, boost dopamine, all that stuff. But before you prescribe medication, how do you kind of figure out if somebody could just kind of be treated with just like talking, emotional expression, going through experiences, and what's like the border of, hey, we got to put this guy or this person on medication?
And before you answer, Alex, it's kind of interesting because we have this natural pharmacopoeia that our body's releasing. You keep mentioning that. Go for that walk because endorphins are going to be released. So we have all these chemicals in our body to do this task, but somehow because we stop doing the activity, we just mask it and have to put a Band-Aid on it. Hey, take this SSRI because it's going to give you this neurochemical effect where you can do that from a run and it gets released, right?
Yeah. So there is obviously different situations when it comes to medication versus therapy. And, it's never the same, and it's never like 100% certain that like if this happens, we're doing meds, or if this happens, we're doing therapy. A lot of the times what ends up happening is somebody is seeking help, so they get medicated and the medication gets their functioning up to a certain level. But when they're at this level of functioning, they're like, I want to do more. I know I can do more. So then they seek, the talk therapy or whatever it is. But it's also vice versa. Like I'm seeing somebody, that maybe has an issue with ADHD, and yes, I can give them all these tools, I can give them all these strategies, and we can practice doing all these things to focus, to stay on top of stuff. But if, I feel like they can benefit from it, or if they feel like they can benefit from it, why not try the medication to see if the two-prong approach is going to be helping them fulfill more of, what it is that they want to do rather than just using the therapy. So there's never just one way of doing it, and there's not a cut and clear boundary or a line that we say like, oh, if you cross this line, you need meds, or if you cross this line, you need talk therapy. I think, of course, in an ideal world, having both is the most beneficial, because then you're kind of like tackling things from like the internal, messing with the chemicals and whatever, but, also the emotional, the cognitive stuff as well. So yes, I always, even if a patient tells me that they're anti-medication or, they don't want to try medication, I do have them at least try to have them meet with a psychiatrist just to get evaluated, see what the psychiatrist thinks, because psychiatrists are taught, things differently than I am. So maybe they can pick up on something, and having a treatment team rather than just one individual treating you, that also gives you, more benefits, because there's two different heads, two different set of eyes, two different people that see you in two different settings that can pick up on some of the things that are happening.
Are you noticing any kind of trends or certain issues like depression, anxiety that are kind of more prevalent now that you kind of haven't seen before?
That's a good question. So I'm seeing a lot of trauma. trauma responses to certain things that have been happening. For example, nurses or people in the field experiencing trauma from seeing, people dying on a daily basis, an hourly basis, people who have been intubated, right? People who came in to the hospital fully okay, functioning, and, COVID they deteriorated so quickly, they thought the person was going to make it and then they haven't. Like, that is a pretty traumatic event, and I'm sure you guys can speak to this more than I can, but just think about the patients that you maybe saw coming in and they were completely fine, they were okay, their level of functioning was not bad, and then they got intubated and then that's it. Like, they never made it past that. And I think we mentioned talking about this, but there's a lot of burnout when you don't get to see somebody succeed, or when you don't get to see somebody recover. So, for example, if I was working in a hospital setting where we were just bringing people in to get them stabilized and then kind of sending them on their way to their next step, that to me would cause a lot of burnout, because I only get to see this person at their lowest, and then we kind of patch them up just to get them going into another treatment setting, but you don't actually get to see this person flourish. And I think what drew me to private practice was being able to have that time to develop those relationships, to develop that rapport, to actually see my patients getting better, versus we just do like the crisis kind of setting where like we have somebody come in from the ER or the ambulance or whatever. We get them good enough to function on a daily basis, and that's it. Like, I have no idea what happens after that.
With like PTSD or like trying to break someone's fear or traumas, do you use like cognitive therapy for them, or what's the approach to those?
So I am actually interested in EMDR. Haven't done it yet, but I know that
What is EMDR?
EMDR is eye movement, or is it eye movement desensitization? It's a weird therapy, right? Like, weird because a lot of people say that it doesn't work. A lot of people say that it does work, or it's too good to be true. A lot of people have this idea that it's not supported by enough data, or there's not enough clear-cut studies that have been making this, like, why is this actually happening? We don't know, the mechanics behind why it's happening. But I think, from what I've heard in the field and from people who have had this sort of therapy, nothing but good things. So that's something that I'd be interested in doing. Obviously, with trauma work and being a trauma certified therapist, there is certain things that you have to include in your work. So making sure that it is a very small, trusting, tight-knit, community or relationship that you have with your patient, because trauma, you do need that safety and you need that accountability, reliability. What is traumatic is how quickly things change and what trauma does to you. So you don't want to go see a therapist and develop this relationship, and then, for example, your therapist then says, hey, I'm going to go on a 3-week vacation. That's not going to be beneficial to the person who has suffered a traumatic event, because then sort of severance in that relationship and not having that accountability, reliability doesn't feel good. Of course, understandable. So, just making sure in my work with people who are impacted by trauma, I'm not 100% trauma certified, working on it, but just doing trauma-informed care, making sure that we provide the safest, most comfortable environment, and we do have that accountability and reliability. That's the backbone.
With eye movement therapy, I think that has some validity, and I'm not sure if you've ever heard of like red light therapy, but like even when we sleep, like REM sleep, it's like rapid eye movement, and there's still like brain activity going on with that. So I'm sure there's gonna be ways to kind of figure out how when your eyes move, maybe they could reprogram some of your brain.
Yeah, so that's actually what they do in this therapy. We're trying to reprogram some of these things. We're trying to desensitize you, walk you through the trauma, and actually have you be okay with, yes, this happened, and now we're better, we can handle this, like, you made it through this. Just desensitizing people to some of these events. But just think about how hard it is for somebody to handle trauma, and then how much harder it is to then go to a therapist and have to relive that trauma all over again, and then kind of discuss the trauma, the response. Trauma work is so difficult, and it is very successful if done the right way, but there is a piece that we are missing, and that piece is, breaking down the stigma and getting more and more people into our doors. And there's also that connection with substance use and trauma, self-medicating because we had this traumatic event happen in our lives and now we can't handle it. And the only way that we get a break or we feel good is by indulging in certain substances. There's a lot of work that needs to be done there as well.
What are some like traits or values that this person needs in order to overcome this trauma or this PTSD? Example would be maybe gratitude, right? Like maybe gratitude is a bad term, but openness, let's just say. Yeah, like even though things are happening, he has acceptance of it, right? Because if you never accept it, you can never move forward. And then you can have, let's just say, gratitude. So what are maybe those values or traits that this person needs to learn to adhere to cope with the trauma and then move on?
So a lot of people that cope with trauma or that are struggling with some sort of traumatic event, they think that they don't have what it takes, right? So, it kind of hits them in a way where like, oh my God, this thing happened and now I don't know how to process it and now I don't know what I'm going to do with myself. But the reality is that everybody has what it takes to cope with that trauma, and maybe they just need a little bit of help kind of pinpointing those things or bringing those things forward that would make it easier to cope with the trauma. But like I said with the values thing, if your traumatic event is putting you, more and more distant away from the things that bring you joy or the things that make you happy, make you feel good, the values thing is always important because you want to look at, like, when you strip all the things away, like if you strip the gratitude away, if you strip, everything away, what is it that's at the core of this person? What is it that this person wants to be known for? Or, if you were to write like a speech, if you're giving someone an award and let's say Matt or Peter are getting an award for something, and the way that I would describe Matt and Peter is they're healthcare workers, so they're very helpful and they're nurturing, right? So maybe your trauma gets in the way of being that nurturing person, but it's something that you value to the core, and it is so, deeply resonating with you that you want to be known as that person. What are we going to do to bring you back to being that nurturing person?
Okay. So what are some practical advice for people that are listening on the show? Maybe 3 or 5 questions you can ask yourself maybe on a daily basis or weekly basis to assess your own mental health and to know where you are, or maybe your imbalance and how to get there?
Also a good question. So, a lot of the times, I don't even know if we can start with those questions, because just think about how many people are straight grinding, every single day, every hour of the day, right? Like the nurses, or, the people in the healthcare field, or the people who are doing all these things to make it in life. How many of these people are so overscheduled and so occupied, they don't even have a chance to check in with themselves, right? So my first question would probably be to ask, to have somebody ask themselves, like, how much time am I dedicating for myself? And not time, because I know the nurses are going to say, well, yeah, I'm dedicating, 40 hours this week to myself to help with the podcast or help with the business or whatever. Not that. Like time to self-reflect, time to, if you're into it, meditation, time to, just make yourself feel pleasant. And I get it. You have a sense of satisfaction and happiness that you get from your work. But this, outside of your work, this is just pure time for yourself. How much time are you dedicating for yourself to check in with your feelings, with your functioning on a weekly basis or a daily basis? So that's question number one. And then we can kind of move on from there, because let's say your answer is like 0. I don't check in with myself. I don't even know what that means. Well, then we have a problem, because a lot of people don't have the education. Like, yes, in schools right now, we get that social, emotional functioning, that education on like feelings and stuff like that, that the good, schools have incorporated into their curriculum. But let's say that you don't have enough psychoeducation to know how you're really feeling. So that is just a follow-up question, like what am I doing? How am I feeling? All those questions, if you don't have the vocabulary or the knowledge to answer those, that would be something that would, be important to work on. Let's say you need a class or you need some education on finding out how it is that you're feeling or how you're doing, because you don't know that. You don't have that background. You've never been taught to actually tune in with your feelings or put a word or a number or descriptor on how you're doing. So that would be kind of the second question. Do I even have the emotional vocabulary to answer, to myself how it is that I'm doing, to gauge how I'm doing? And then question 3 would obviously be the thing that I kind of repeated in every single episode that I've been on is, am I getting adequate sleep? Am I getting adequate nutrition and movement in my life? And I know that there's a lot of holistic life coaches out there who, nothing wrong with those people, but a lot of people who just preach movement, nutrition, sleep. And I think for anything that's wrong with a person with a broken leg, for example, or a person with, any sort of thing under the sun that's happening, if you're not getting those 3 bare minimum things, then you just think about Maslow's pyramid, right? Like, how can you move up a level into a higher level of functioning if you can't pay attention to something because you haven't slept, or if you're starving yourself, or if you're eating things, and I'm not gonna sit here and tell people to only eat whole foods and all that, because I know life doesn't work that way.
We take care of it.
Right. But no judgment for that. But let's say that you're consistently eating things that don't make you feel good, right? And it's bringing you some sort of anguish or turmoil, and you're not doing anything about it. So you're constantly eating this bad food. You feel bad about it, you think about it, then it makes you feel even worse, right? So just think about those. And then the movement piece, which is, one of the most important pieces. If you crave movement, if your body craves being outside in the sun, which as a human being, it should for at least 10, 15 minutes a day, if you're craving that, but you're not getting it, then, how do you imagine you can function? How can you continue existing if that vital piece that would make you feel fulfilled is missing?
There's a lot of like negative stigma associated with like therapy and seeing a counselor. And the first step obviously is to have that person come to the office, but the next step will be to get their 100% effort and their honesty. So how do you get somebody to open up that might have came into the clinic but is still kind of iffy on expressing their problems and their emotions, and still struggles to be open and give you their 100%? Because you can't treat them properly if they don't give you their full honest opinion and their few honest viewpoints on themselves. So how do you kind of establish that relationship?
Well, I will try to tie it into nursing in the hospital, for example. When you are seeing a patient, they have their privacy, for example. So like maybe minus the ER, which even in the ER you have a little curtain or whatever next to their bed. But if they know that they're in a private environment where whatever they share is not going to be told to anybody else, right? That's helpful. But even HIPAA, for example, so the health information protection, like the way that I explain to my patients is that whatever is confidential, in this room, everything's confidential minus the thing about harming yourself, others, right? So people that know that their stuff is not being shared, whether it's with healthcare workers or with counselors, that is something that helps. Building a relationship is important. So somebody has to rely on you to be accountable, be reliable. That helps, because if they know that they can consistently see you on a weekly basis and you're always going to be there for them, and that you're going to take a non-judgmental stance on whatever it is that they share with you, that is the biggest part of the relationship. And there are even some therapists that have said, some philosophers and people from way back in the day, that if you have that relationship with a patient, nothing else matters. Now, maybe that's not the case right now, and, we know more, whatever, insurance companies aren't just going to fall for that one. But there are a lot of people who believe that if you have this trusting working relationship with somebody, you don't need to do anything else, because everything in your team effort thing will fall into place. So you'll end up covering those challenging things. You'll end up working on the depression, the anxiety, as long as that relationship is there. You trust your provider, and you're getting feedback. They're a good listener, and that non-judgmental stance.
I'm always curious about like your clients and your patients. Is there anybody that like sticks out to you in your past that you've kind of helped with or are currently working with?
So obviously, due to confidentiality, I can't give the most details, but there are definitely patients who I work with that have overcome a lot, right? And my biggest thing is right now that I see a lot of people who I tell them that they have lived a very big life in a short span of time. So what I mean by that is, let's say that, you have this 12-year-old, for example, and this 12-year-old has dealt with the pandemic, dealt with moving, dealt with a new mental health diagnosis, dealt with their parents' divorce, dealt with their best friend dying or something like that. Imagine all those compacted events into a very short period of time. And then imagine this 12-year-old trying to work through all those things. It's like all these things are happening all at once. Their head's spinning. Everything's happening. They cannot make it stop. So how do we create space for them to feel safe and space for them to heal and, work past those things? So a lot of my patients and a lot of the people that all therapists are working with, because if you add the pandemic on top of regular daily life things that are happening, it's so much happening all at once. And, there doesn't seem to be a place where children or adults or anyone suffering from all these things, they can find that safe space to kind of talk about it, because it's like, well, if everybody else is dealing with the pandemic, or if all my aunts and uncles or if all my cousins are dealing with divorce, then why do I need this safe place, right? Mm-hmm. Well, that train of thought just leads me to say hey, maybe those other people are dealing with it in a different way, but maybe you need more help or more structured time to deal with it. So it's okay to need that space.
Going back to question number 2, how do you develop that emotional literacy so you can put your feelings into words and you can learn how to express yourself?
So a lot of that, of course, there are books that you can read, plenty of books on the internet, plenty of YouTube videos that you can watch about emotional literacy and expressing and feeling and stuff like that. But a lot of it is checking in with yourself, maybe even writing stuff down. So let's say you have a very big, powerful feeling, and you feel it in your chest, you feel it in your gut, you feel it in your fingertips, for example, your heart is pounding. A lot of things like that help you be in tune with yourself and with your feelings, because we can get a better understanding of the feelings that we have by checking in with not only our head, right, like our brain, but also with our body. Just seeing how it is that we respond to these feelings, how these feelings present to ourselves. And yes, you do have to, know the words for explaining the feelings, because there's something that I use in my practice called the feel wheel. And I like to put a few words in the word prison, as I like to call it. So when you're sitting in the room with me, there is no I feel good, or I feel bad, or I feel annoyed. Because what does good feel like? Good isn't a feeling, it's just a descriptor word for a quality somebody has. Oh, this is such a good dog, right? What does good mean in terms of feelings? What does annoyed mean? What does bad mean? We need to take it a step further. And a lot of people don't have that emotional literacy and that emotional intelligence and that capacity to explain to me that they're feeling frustrated or they're feeling betrayed, right? Like those feelings that we can work with, because, now we can kind of challenge like, hey, what is it that's making you feel frustrated or betrayed or lonely? But when you say that you're feeling sad or upset, or like, those words don't give me much, and they're just the bare minimum. And unfortunately, a lot of people that we see, in their early 20s or whatever, they don't have anything past that, because not only in school was it not really taught, but then in the home, it wasn't really taught to ever say, the exact thing you're feeling, because nobody would deal with it, right? Like, you wouldn't tell your mom, hey mom, as a 5-year-old, you wouldn't say, hey mom, I'm frustrated because I couldn't get, this ice cream, even you told me that I could get ice cream after I finished my homework, right? Like, nobody ever says that. They just say, I'm angry, and then storm off into their room. And like, what does angry mean? Anything could mean anything.
Yeah, it's literally like you're peeling off layers of the onion. Like for nursing, for example, when someone says, hey, I'm in pain, like, okay, I know you're in pain, it's very broad, but is it a sharp pain? Where is it located? Because it's like mental pain when they go through depression or those anxieties. So it's crazy concepts to think about. How long does it usually kind of take for somebody to kind of start seeing improvements? Does it take a few months, a few weeks? Do they come see you every day? Like, what's the process?
So the process varies on the severity, right? And the sort of level of care that they're in. Because, for example, I know you guys know about F codes, right? And you know about the different differential diagnoses that you can have, but there is not just one depression, right? Like, you don't just have depression. You could have major depressive disorder with reoccurrent episodes, and those episodes could be severe. You could have major depressive disorder with one episode, and that was a mild episode. You could have something like dysthymia, or you can have, bipolar disorder with low-lying mood swings or things like that. So it just depends on how severe it is to begin with, where you're being seen, for example. Because if you go to the hospital, you're taken by the ambulance because you're feeling suicidal, it might be a very short period of time that that you're given to be stabilized and be okay enough not to be suicidal and, go on to the next step. And, it could be a short few days. And then the more work you do, right? Like, the bigger piece is then getting you to function and shower every day and brush your teeth, right? That might take more than a few days. And then, the step after that would be like, okay, are we attempting to do the things that bring us pleasure in our life? That might take a few weeks. So it just depends on severity, and it depends on which practitioner or what level of care you're being seen at. I'm sure it's the same exact thing for you guys. Like, if you're being seen in the ER, if you're being seen in the ICU, if you're being stepped down, right? Like, there's different levels of getting better that you're seeing and different levels of care.
Thank you for explaining that. Alex, it's always a pleasure talking with you and learning knowledge about psychology and diving deep. We're looking forward to seeing you again and chat soon.
Thank you so much.
Yeah, of course. Thank you for having me.